Welcome to episode 89 of Talking Dairy, Lameness in Dairy Cows. No farmer likes to see their cows in pain. It's a challenge every farmer faces at some point. But how big is the problem and what's its real cost? What can we do to prevent lameness and how do we best manage those cows that do get lame? I'm your host, Jac McGowan, and joining us to answer these questions and more are Frank Portegys, Senior Area Manager for the King Country at DairyNZ, and Winston Mason, a veterinarian and epidemiologist from EpiVets in Te Awamutu. Winston has a passion for helping prevent dairy cow lameness, having started his vet career with placements in Taranaki, where he got to learn from the original lameness guru for New Zealand, Dr. Neil Chesterton. Winston and Frank share how farmers have been dealing with lameness in recent seasons and cover the common causes. So stay tuned for some great insights and practical management strategies to take away that can make a real difference on your farm. Tēnā korua, welcome to Talking Dairy. Thank you for joining us today, Winston and Frank. Let's start by finding out a little about each of you. Frank, we'll start with you. What's your background and what do you do in your role at DairyNZ?
Well, I was brought up on my parents' dairy farm. They had a farm just out of Morrinsville. Before that, they were share milking, so we moved around a bit, sort of Morrinsville, Te Araha, and Ngātia on the Hauraki Plains. Went to Massey when I finished school. After I graduated, had a number of roles working for MPI, although it was MAF at the time, so that probably ages me. Worked on the fertiliser industry for a few years and then ended up at Texel, which later became DairyNZ. So I started off as a CO. A few years after that, had the opportunity to go farming. So we milked 400 cows in between Morrinsville and Cambridge. We had a split calving operation there. Ironically, while doing that, I got kicked by a cow when trimming hooves. And so that aggravated an old injury I had. And so that sort of made milking cows full-time a little bit problematic. So we put a manager on. I came back and worked with DairyNZ. And a couple of years later, we've ended up selling the farm. So now back to DairyNZ full-time. So I'm a senior area manager. I'm looking after the King Country area. I guess my role there is sort of organising and facilitating groups and just using the farm system knowledge to help farmers become better farmers.
Thank you very much, Frank. So a lifetime of both dairy farming and supporting farmers that you bring to this conversation. And Winston, tell us a little about yourself.
I went to Massey as a budding vet student from Auckland, thinking that I wanted to, spend my days treating cats and dogs, and quite quickly fell in love with the dairy industry. So I dairy farmed and saw prac work in Taranaki and had the honour and privilege of being under the tutelage of Neil Chesterton. So very early on in my vet career, I saw lameness as this big key topic that I wanted to investigate and try to help improve across New Zealand. So I've been a dairy vet for about 15 years. I managed to do a stint over in the UK and in Australia, so I've had a view of lameness across different countries. But when I came back from Australia a few years ago, I really wanted to push the research a bit further, really get a high-level understanding of lameness in New Zealand. So I've just finished up a PhD in cattle lameness through various topics throughout New Zealand. And a couple of years ago, moved into a full-time research company called EpiVets, which we do all sorts of fun lameness research across the country.
Brilliant. Thank you so much, Winston. So from city boy to very much a dairy vet and living that life now. Okay, so let's get to lameness. Let's start at the beginning with some definitions and the size of the issue. So, Winston, what is dairy cow lameness and how big is the problem globally and in New Zealand?
Dairy cattle lameness, simply defined, is a cow that is walking abnormally. So it can range from all sorts of things, from neurological conditions right the way down to really painful things. When we refer to dairy cattle lameness specifically, most of that is the result of pain in the hoof. And in New Zealand, it is the result predominantly of pain actually in the claw, so white line or sole injuries. So if we're looking at global understanding of lameness, there are two measures that we tend to use. So one is prevalence. So prevalence of lameness refers to the number or percentage of lame cows on any given day. So the percentage of lame cows in your herd today. And the other measure we often use is incidence. So that's the percentage of lame cows over a season. We tend to rely on prevalence just because it's a lot easier to record. It's a lot easier to go out to a farm on a day and go, right, this is the percentage of animals that are walking abnormally, so truly lame. Globally, it sits around about 1 in 4 animals are lame. which still makes me so sad when we look at the international research. It truly is arguably the biggest animal health condition that the global dairy industry faces. The good news is New Zealanders were nowhere near that level. So we just finished off a prevalence study looking at 120 farms in New Zealand from the top of the North Island to the bottom of the South Island. So quite a good representative range of farms. And across those 120 farms across the year, we sat around about 3% of our herds were lame on the day that we visited. So 3% compared to 25%. So there's some positive news stories in New Zealand. The flip being, we had some big ranges. So although we can say as an industry nationally, we're doing pretty well for lameness, some of our farms were as high as 17% of cows that were lame on any given day. And we know how much of a burden that can be both for the cow and for the farmer. So there's still plenty of room to improve.
Let's bring it to this season, Frank. How much of a problem is lameness on farm this year? And are there any common challenges or themes coming through from the farmers that you're talking with?
Well, the Waikato farmers, at least who I have most contact with, there doesn't seem to be sort of any trends. It's very hard to say that it's worse or better this season. Now, there are individual farmers who are having more problems. I know there's white lines will be a bit of an issue this year. Another farm, it's foot rot just with animals with something stuck between their claws. But as a general trend, I don't think there's anything in the Waikato. Now, speaking to some of my colleagues around the country, some of the ones in some of the areas which have been a bit wetter this spring, like Taranaki and especially down Southland, they are certainly saying that lameness has been a bigger issue. But yeah, not saying that the wet weather's caused the lameness, but it certainly is a aggravating factor. And even in that situations, there are farms down there which aren't having a big problem with lameness. So it seems to vary from year to year, farm to farm.
Yeah, and going back to what Winston said about his research, even within one season can be a big range between farms. Before we go on, you've both mentioned white line, and I'm sure most of our listeners will know what it is. But just in case, what is this white line that you're talking about?
We tend to talk to things of white line and sole lesions, and what we mean when we refer to that is on the bottom of the hoof, the hard claw substance, there's an area in the hoof that joins the sole, the bit that hits the ground, and the hard outer surface, the wall, like the fingernail. And it's that area known as the white line. It's a glue that holds the two together. It's also one of the weakest points of the hoof. It's the one that ends up opening up when cows are pushed and twisted on. So it tends to be in New Zealand sitting where we find the most amount of problems.
Okay, thank you. And staying with you, Winston, can you break down for us the direct and indirect costs of lameness for farmers? What's often overlooked when it comes to the real cost?
To really understand it, we need to break it down into its sort of categories and think far beyond just the financial cost. We asked the 120 farmers, we asked them what they thought the biggest cost and barriers to lameness were to them. And some of the top responses had nothing to do with a financial cost. So the pain and suffering of a lame cow has to be thought as the primary cost of lameness, the welfare cost to the cow. We can't quantify it. These are prey animals. These are incredibly tough beasts. If they've got to a point where they're showing pain, there's probably quite a severe thing that's happened to them. And following on from that, that's the cost and welfare to the farmer themselves. So I got involved in it, because I wanted to improve the welfare of cattle, but just to see the farms that I worked on, the impact it had on the farmers and the desire to want to improve that is pretty compelling. So when we talk about the cost, especially advisors, I think we really need to have both welfare for the cow and farm right at the top. And hopefully Frank will allude to that a little bit further with a real life farmer. It's a much better example. But if we want to break down that specific financial cost, there are some areas of New Zealand data that are lacking, but some that we're getting more and more info on is actually the reproductive cost of lame cows. So arguably, if we're getting lame cows in the spring, I would say that the biggest cost is actually poor reproductive performance and increased culling. So watch this space. We're getting quite a bit out there, but that in itself can result in conservatively more than 10% of those cows extra empty or non-pregnant at the end of the season. So back of envelope cost calculators can be quite useful and persuasive when we're trying to work out control plans.
Thank you, Winston. And yes, Frank, you've talked about being a farmer yourself, and I would be interested to know from your perspective, what's been your experience of managing lameness and the costs that Winston's just talked about?
Well, from my point of view, one of the biggest costs is just it's so demoralising as a farmer, because no one likes to see cows limping and obviously in pain. And if you just finished the morning milking, you've got 3 or 4 cows that you've identified as lame, you're going to sort of lift some hooves and have a look. You know that's probably another hour of work before you go home and have your breakfast. So yes, it's just the time. If you've got a hospital mob, it's another mob of cows to shift. You've got to give them extra feed, so that's another job. And like Winston mentioned, the repro, and when most of the situation, it was often in the spring we'd see them get lame, and if it's before the mating or even during mating, when we actually went back and looked at the cows that didn't get in calf, the lame cows we called as being lame were sort of overrepresented in there. And also they tend to get lame more than once. So at the end of the year, when we're going through our cows, we started sort of treating it a bit like mastitis. So cows that had sort of 2 or 3 incidents of mastitis or lameness, we ended up putting on the naughty list, and they got culled.
There's a lot in there. There's sort of lost potential of cows, the extra pressure and spring of the time required to manage them, the yuck feeling of just having cows that are in pain. And also from my own experience that, in spring there's never enough hours in the day anyway, so there's this sense that you're not able to do as well as you'd like to. Frank, you mentioned that cows would often get lame again. This seems like a good time to go to you, Winston. I vividly remember you showing us some pedal bones or hoof bones of lame cows, or cows that had been lame and cows that hadn't been lame. Can you tell us about those pedal bones? Like, why was I so shocked?
Yeah, I really wanted to jump in there when Frank was saying about the repeat cases. I think that is such a key message. One of the favourite communication tools to improve lameness is actually the box of bones that I carry around, the sad lameness researcher that I am, which I learnt from Neil Chesterton. So we now have a very, very, very large amount of evidence to understand and show that one of the biggest risk factors for lameness is a previous case of lameness. So DairyNZ has some lovely resources on this. That every time a cow gets lame with white line or sole injuries, so the thing that's actually affecting the claw, it can put in line this negative cycle that results in actual change in the bone inside the claw itself. And this cycle goes on and on again, and it does make a cow much more likely to get lame again and again and again.
What is the difference between those bones of the non-lame and lame cows, and why does that change that you see cause lameness to happen again?
So when cows get lame with things like white line and sole lesions, the actual bone inside the hoof capsule itself changes shape. It gets larger. It gets these almost arthritis-like changes in place. And that bone increases in size, but the claw itself, the hoof that it sits inside, stays the same size and shape. So what you end up getting is a bone that has sort of pressure points stuck inside this capsule that then gets more and more pressure onto it. So we genuinely see these cows become more likely to get lame and lame and lame. And I liken it just similar to a mastitis animal, that if a cow gets mastitis 3 or 4 times in a season, as farmers, we know that girl's probably got to go. The same thing, I would argue, really should be happening with cattle more, and for that we need to have recording happen. So recording when a cow gets lame, what it gets lame with, and then making culling decisions at the end of the year based on that can genuinely make quite a big difference to the lameness status of your herd going on.
Okay, so it sounds like once a cow's been lame, that inflammation almost makes her like foot too big for her shoe for the rest of her life, which, I'm laughing, but actually I can imagine that's a miserable feeling.
And plus put a couple of stones in the bottom of your shoe and have that niggling away as well.
Yeah.
Can you make that inflammation or bone sort of growth less? Is there ways to reduce that?
Once that bony change is there, it's there permanently. Again, think of like arthritis. Once, as a person, we have arthritis, we can minimize the pain and the impact of it, but we can't really, under the crazy surgeries, we can't change that bony arthritis thing. What I talk about over and over and over again is we can prevent that from happening in the first place. So once an animal is lame, if we identify it as early as properly and treat it properly, which includes things such as anti-inflammatory drugs, the clue's in the name, anti-inflammatory drugs, and things like blocks or cowslips to elevate that, we can make a big difference at stopping that negative cycle from happening.
Okay, so Winston, we've talked about what happens if a cow does get lame and the long-lasting damage that can cause. What are the most important things a farmer can do to manage lameness?
So from my perspective, the best thing that we can do on every farm is to identify and treat lame cows better. So that's not to say that we shouldn't be looking at trying to prevent lameness in the first place. There's some fantastic information and fantastic resources on how we could do that. The challenge is, and I certainly felt that when I was a vet trying to give advice, is it's so different between farms. As a farmer, you might see that you need to spend $100,000 on races, and that may or may not make a difference. Another farm's got 100 mils extra of rain the last week. That can be really challenging to do much about. But consistent evidence is so that if we make improvements in our identification and treatment of lame cows, we can make a benefit for the animal and for every farm. So that's the simple messaging, is start a simple messaging, sometimes harder to implement, but have a farm plan and protocol on how you're going to identify lame cows early, and then how are you going to pick them up, treat them, and then manage their recovery. So for that, we put together a 4-point plan on different stages of improving the detection and treatment of lame animals. So first, and by far the most challenging, is to identify lame animals early. Now, there are multiple ways that we can do that. So we can actually get out there and formally locomotion score, lameness score the herd. We could bring in some new technology. So there's some really cool automated technology that can help identify lame cows on farm. But bigger yet is actually still formalize this process on farm. So what we found through a ton of research, really exciting research, sitting there watching cows walk, is that the really bad ones do sit at the back of the herd. So as farmers, pretty good at identifying the really bad ones. Some work from Massey on about 60 different dairy farms found that there were 70% of animals that, as researchers, we would call lame, were sitting in the walking in the milking herd that weren't getting identified on the day by the farmer. That's by far our biggest area of opportunity, is to identify these lame animals that actually are walking abnormally, not just funny, they're truly lame, identify them earlier. And that doesn't mean that we need to identify every single one of them, but it does mean that we need to formalize this process. So I like going back to mastitis. I find that's a simpler example to deal with. If we have a mastitis problem in the early spring, we have a somatic cell count problem, we might be grading. What do? We strip the quarters. We go out and actively look with it. We put a protocol and plan in place to say, today we're going to look at the back left quarter of all of the colostrums. I don't know many farmers at all that formalize how they identify lame cows. That is one of the biggest opportunities that we have. That might be too much, so I understand that that's another job and already time poor thing. So then we move to the second stage of it, which is picking them up and trimming. If you don't have a proper crush, it doesn't need to be a hoof crush, but if you don't have a proper crush, you can't do a treatment job appropriately. So why is that? Well, if we move into stage 3, the answer becomes much clearer in stage 3 of that. So to be able to get the best outcome for the cow, for production, and for longevity, as in will they get lameness again and again, we need to be using blocks and non-steroidals for almost every animal, as many animals as possible. And it's just not possible to put on a block in a time-efficient manner without a decent crush. And what we find time and time again is it's a job that most people hate doing. But once we get a system in place, a setting, a crush and a race and everything in place to do the job properly, or hire in professionals such as hoof trimmers. I've had farmers that turn around and actually want to do lame cows. I kid you not, because you're getting onto them in a system, you can move them through faster, you can get 10 to 15 done in an hour and treat them properly. But that stage needs to happen. We need to have good facilities. And sometimes that requires input from external help. So ask the vet, ask your hoof trimmer. These are the people that see all sorts of good and bad systems. But I would concentrate on getting that set up. You can get a second-hand crush for a few $1,000s that you can get an engineer to tweak around. That's an area that if I was going out to farm investigation, that's the first thing I'd go to. If they don't have that, we bring in a crush. External party come in and actually do the job. And Frank, you did allude to that, you moved out of your role because of an injury. Trimming hooves without good facilities is an incredible welfare risk for farmers as well. And unfortunately, I know several farmers that have bought a crush too late. We've got somebody else to help because they've injured themselves as a result of it. The last thing you want is to be kicked by a cow, cut with a hoof knife, and then get even further behind. So point 1 is identify early. Point 2 is make sure you've got the facilities or get somebody in that has the facilities to do the treatment for you. Point 3, we refer to as manage the pain. I explicitly mean use of blocks, cowslips, or jandals, whatever you use. I don't get too caught up as long as we're using them. And pain relief, anti-inflammatory medications. So that's point 3. And then even if those aren't possible on farm right now, it's normally possible on most farms. And the 4th point, to improve the outcomes of our lame animals, it's starting looking at the recovery. Once you've identified and treated these lame cows, how are you managing the recovery practice? And there are 3 things that I like to think of for that. Firstly, there's very few conditions that make an animal lose body weight as much as lameness. And an often forgot about thing is that we'll put them nice and close by the shed, which is perfect. That's so nice for them. But if you have a big lameness problem, you might end up with a lame cow herd of 50, sometimes 100 animals. And not always is the dietary requirements then moved on to those 50 to 100 animals, the animals that need it the most. So you find that the milking herd gets fed better and the lame animals get fed worse. So again, it's a formalization process of this, making sure that we have, there's this number of animals in the lame mob. We're going to feed them not just the right amount of ME, but it needs to be high quality ME. These girls aren't going to be walking anywhere near as much as the herd. So ensuring that the dietary requirements to the lame herd are at least matched to the milking herd. We know that will improve recovery. We've got data on that improving recovery. The second thing in the recovery thing is actually record if they're getting better. So I like to have a weekly sweep through the lame herd, locomotion score them and go, yes, she's good, go back in the herd, or more importantly, no, she's still lame after 2 weeks. Let's pick her up again. The longer she's lame, the more likely that bone changes to happen and the more likely that negative cycle is to occur. And the third and final thing on that plan is to minimize time on concrete. So I said at the start of this podcast, concrete's probably the worst thing we can put on hooves. It is definitely the worst thing we can put for lame animals. So I know it's never done on purpose, but I've gone out to several farms where the colostrum and the lames and the mastitis cows, they're all put together and they stood on the concrete waiting for the shed wash to go through. Every extra minute that those lame cows spend on concrete, we're hindering their recovery. And it's part of the reason why in the UK the recovery rates are so poor is because the lame cows never get a chance to rest up properly.
You mentioned putting hoof blocks on as many cows as practical or possible and the pain relief and the anti-inflammatory. So are there types of lameness where you wouldn't need to use blocks and anti-inflammatory? I'm thinking like, say, maybe foot rot in between the claws.
Yeah, so I obviously went on quite a while there for those 4 points because I think they're so key. But you're right, Frank, they do contain specific details relative to the farm. So I think each farm needs to have their own plans. And one of that would be to work out what your primary sort of lameness is on farm. For foot rot, the jury's out. I mean, I don't personally use blocks or cowslips for foot rot. Most of those will need antimicrobials to respond to treatment, but the anti-inflammatory part I still would. So we've got some data coming through to show that foot rot itself can cause negative reproductive outcomes and that anti-inflammatories may assist at reducing that. In my experience anyway, having do this makes it more likely that nothing happens. So provided, you speak to your veterinarian and get the appropriate recommendation and script for those drugs, when I'm going out there, every single lame cow I see receives anti-inflammatories. I think just from a welfare perspective alone, there's justification on it. And now with reproductive and sort of culling stuff coming out, I think from a production aspect, it's also starting to become more and more justified.
So tell me again, Winston, what were the 4 points in your plan?
So to separate out to the 4 key areas that we can make improvements on farm would be 1, to identify lame animals as early as possible. 2, to pick them up and trim them. 3, I put under the umbrella of manage the pain, and manage the pain includes putting blocks or cowslips on them and non-steroidal anti-inflammatory medications. And the final one is manage recovery. So what are we doing to the animals once we've identified them and trimmed them? How are we managing that period until they become walking normal again? So back to being sound or non-lame.
Perfect. Thank you. Winston has talked through the 4 areas of managing lameness, and he was open that was in an ideal world and that sometimes in practice we might not hit all of them, but we have to start somewhere. Frank, how do you see it in practice? What do you see farmers doing in terms of putting into practice, identifying lame cows, picking the feet up, trimming them, managing the pain and looking after their recovery?
I think one of the things that farmers could look at, and it certainly was in our situation, is stockmanship. This harks back to like Neil Chesterton you mentioned early, and a lot of the stuff that he found is that in a lot of cases it was the interaction between people and the cows sort of leading to increased incidence of lameness, especially white line. So just little things like use of the backing gate in the cow shed. I've seen farmers who put the backing gate on a timer so it only goes 3 seconds before it stops, so it reduces the risk of leaving the backing gate on or having the cows too tight in the shed. When the cows are walking to the cow shed, don't put the pressure on, let the cows walk at their own pace. One thing you mentioned about was reducing the amount of time cows are on the concrete, but I wonder whether introducing the heifers early to the cow shed, getting them used to the cow shed, getting them used to standing on the yard, going through the cow shed, or even getting used to the older cows, introducing them before calving as opposed to once they've calved, how much of a difference that makes.
That sounds like a question for Winston. So we do often see different patterns of lameness in heifers. Can you talk to us about that?
Between farms, there's difference in what age of animals get lame and the type of lameness that they get. And Neil Chesterton summarised this absolutely beautifully. And we did actually set up a study to try to do exactly what you said, Frank, to look at basically getting them used to, getting them match fit to the stuff that heifers are going to be exposed to after calving. It was quite a confusing study to set up, and we didn't end up finding massive benefits in I guess, managing them differently before calving. But at first principles, it makes perfect sense. So the lameness that heifers are often getting is what Neil referred to as basically getting bullied. So as opposed to in adult cows, they're often on the outside claw of the back legs, where they're kind of pushing around and holding their own. In heifers, we tend to find them in the inside claw of the front legs. I mean, it's almost a magic trick. If you see a heifer, without even seeing a walk, you go, it'll be front claw. And Neil's got some great videos on this, and that's them sort of pushing back, being quite submissive. So although we don't have good hard data on that, I absolutely agree that that's just good practice in general, I think, is having as fewer changes to an animal on a given day as possible. Because what ends up happening is this heifer calves for the first time, sees concrete for the first time, gets hard TMR, concentrates for the first time, sees new staff, sees new cows, gets milked for the first time. All of this can happen on the same day. I think if we can minimise mixing them before calving, getting them exposed to some, not a lot, but some concrete before calving, seeing the staff, I think that's a good move to be doing on farms if possible.
Yes, many farmers will be familiar with the advice around letting cows walk at their own pace, training our heifers a little bit, keeping the yards clear of stones, using the backing gate appropriately, as you said, Frank, and that a lot of that comes from Neil Chesterton's groundbreaking work, which started in the 1980s. Winston, what's new in terms of our understanding about preventing lameness?
The big focus, the new area of interest is actually going back to the cow itself. So I think everything that Neil put out in the 1980s is as true as it was then as it is now, and absolutely every farm, we should be using that information. It hasn't reduced in importance. We just probably hadn't concentrated as much on the cow itself with stuff. So that goes into the essence of the repeat case of lameness. So on a farm, a cow will get lame, another cow won't. The pushing and stuff doesn't always, and the weather doesn't always explain that. Whereas the cow itself can start explaining more of that. So we've gone back to a more cow-centric approach. And that's the essence of improving the treatment of that individual animal can help reduce the case of lameness in that animal going forward, which then makes the herd lameness reduce. There are multiple angles of the cow. There's things such as genetics and diet and breed, and they all play a part. But I think the best understanding that we've got is actually what's happening to the cow inside the hoof. We've got really cool stuff that we can now help prevent from happening.
So we've talked about prevention of lameness, and we've talked about how we can effectively treat lameness when we find it. For farmers that are affected by, or really their cows, their herds, are affected by lameness issues right now, where should they start to get on top of it? What's the first step to start turning things around?
So I'm conscious that some of the solutions that have been put out there are in an already time-poor system relying on more time. So we asked the 120 farmers what their biggest barriers to lameness control were, and the two biggest barriers were time and skilled labour. So I think a nice, honest appraisal of the current situation. So the best thing you can do if you've got a problem is ask for help. the hoof trimming industry is starting to increase in numbers, and they're there for a reason. We've got some pretty good hoof trimmers in the country now that they're not there just to trim hooves. They're there to help treat as well. So I would always, if we go into a lame cow investigation, we'll look at race and stuff, but the very first thing we'll do, I learned this from Neil, is to actually treat some of the lame cows. It'll tell us what the main problems are of farm, but they are also the ones that are causing both the cow and you, the farmer, the most amount of stress. So get on top of your lame cow problem. If you have 20 bad ones in the paddock, there are probably 50 in the herd, and that's really overwhelming. We're not saying getting expert help with veterinarians and hoof trimmers in forever, but for that first few weeks, the best thing you can do is to get in, call your vet, call your hoof trimmer, wipe the slate clean, and then get on top of things. That, in essence, is a really, really positive way forward.
Thank you. And Frank, I'd like to ask you now, what else is available for farmers when they're dealing with, an issue with lameness, or when they just want to think about preventing it?
Well, I think a good place to start, apart from this podcast, is just have a look on the DairyNZ website, because there's a whole heap of information there. If you can just search lameness, or if you look under topics and select animals and then go lameness. One of the resources there is a webinar Winston actually did a couple of years ago. He was mentioning about these pedal bones and some of the growths on there. You can actually see them on the webinar. So it's a useful tool to upskill yourself, or even upskilling your staff. There's a number of booklets and resources you can use. Again, great for staff training. But get extra help. If you're time poor, it may just be getting relief milkering, so that frees up time for yourself to do other chores, or treating lame cows, or get a hoof trimmer, or get your vet in just to help get on top of the issue.
Yes, I also know on our website there's a video about how to locomotion score or lameness score cows. I've done a lot of that in my research years as well. There's information about healthy hoof providers. And as you mentioned, Frank, there's some guides there. There's a healthy hoof field guide, which talks about what you're looking for in the field on farm, and how to treat them. Thank you both. So that's a wrap on today's discussion about the real cost of lameness in dairy cows. Lameness isn't just about a cow's ability to walk. It can have far-reaching impacts, as Winston and Frank both spoke about, if it's not properly managed, with costs far broader than money, consuming time, impacting cow productivity, and reducing both cow and human well-being. So if you're facing lameness challenges, as they both said, don't hesitate to reach out to an expert for support, and take advantage of tools and resources that Frank and Winston mentioned, like the Healthy Hoof program, and we'll link to these in the show notes. Early detection and prompt treatment with pain relief is key. Using a lameness scoring system will help give you the insight you need to catch issues early and get your cows back to full health faster. Thanks for tuning into this episode of Talking Dairy. Make sure to hit follow so you can keep up to date with our latest episodes. You can also keep up with DairyNZ News on Facebook, Instagram and LinkedIn, or go to our website and sign up for our fortnightly DairyNZ News emails. As always, if you have any feedback on this podcast or have some ideas for future topics or guests to have on the show, please email us at talkingdairy@dairynz.co.nz. Mā te wā, Mōri ora, catch you next time.